I'd like to thank Tennyson and Hereford Prime for having me here. I'm going to talk a small bit about this new National Veterinary Prescription System. Well, it came into law there, only Charlie McConaughey brought it in October last year, and it came into effect in January the 13th of this year. It's going to bring certain changes, and what is it? It's an electronic database run by the Department of Agriculture for recording of all veterinary medicine prescribed and dispensed for food producing animals. Why is it brought in? Well, it's an EU law. We're probably one of the last countries to have it, so we have to be, as with all EU, we have to tie in what they're doing. The main aim of it is to try and reduce the amount of antibiotics we're using in animals. Going back in the 80s, there was 100 tons of antibiotics used in animals, primarily in poultry and pigs. But it's we all have to play our certain part to try and reduce this. If any of your mothers or dads or grannies are sick in hospital and they need a critical antibiotic that'll only work, we kind of have to play our part. We can't be using the hardest hitting drugs in animals when a lesser drug will work. 30% of antibiotics used in this country are used in humans, and the other 70% of all antibiotics are used in animals. Going back in the 80s, the 100 tons used, that's in 2022 and 2023, that has reduced down to 74 tons. We've made a lot of progress, but a lot more needs to be done. Dry cow therapy in dairy cows as well is another big thing we have to try and cut down on. What is the pros of this? The pros of this NVPS is well, it's going to reduce the amount of paperwork you'll have, for all this Board B and that. It'll all be electronic. When you go into your vet or go into your co-op, you'll have there'll be less. You'll have less paperwork because it's all going to be electronic anyhow. So it'll be set up. You're allegedly it's going to increase the amount of channels that you're going to be able to get vet medicines from or wormers from as well. I say allegedly there, it's hard to know where. You still have to go and get your prescription off your vet and that, so. The cons of this veterinary prescription system is, well, the department are going to have an up-to-date live record of all antibiotics you use. It's a prescription for about 5 days and it'll last on that system for 5 years. So anyone who's using a lot of CTC powder, these oral antibiotics are a big no-no. They don't want you using any antibiotics that are critically, I'll go through the classification of antibiotics, but oral antibiotics they're trying to cut down on that. Right, on this classification of antibiotics, there's 4 types of antibiotics. There's A, B, C, and D. A are the ones, they're critical, so they want us to avoid them. The examples of those would be Cobactin, Naxal, any of those. They're the antibiotics that will work if you need to use them, and hopefully it'll be only your as I was saying, your granny that might need them. The category B would be, these are the ones we want to restrict, the likes of Marbazil and Baytril. You have to try and, that'll only be, you'll have to have used lesser drug first. Category C would be, you have to be cautious with these ones, the likes of Nuflor and Sinilox. We all know, probably every one of you have used those drugs here. We just have to be more cautious and try and use a lesser drug. The one that we're allowed to use, we have to be prudent with them. We're allowed to use is oxytetracycline and Betamax. You can come into me, I can prescribe them, have a chat with you. You can have a store of those. You can have a store in your press. If you have a problem with joint ill, or you can have a store of Betamax. If you know you're going to have a few calves sick, you can have a store of oxytetracycline, Endomycin, and so on. So you're still allowed, once you have a chat and a relationship with your vet, you can have certain antibiotics. You're allowed, this year's calves, 20-25 calves, you're allowed to put them down as a group, and so you can have once you're not using CTC powder, you just have to kind of go maybe with an injectable. So if you've 75 calves or 30 calves, whatever you have, and 5 of those are coughing, there's no point going in and giving CTC powder, which we probably have all been doing, giving us the whole 70 or 30 calves to stop them all. We kind of have to get down to the 5 or 6 coughing calves and inject those. We have to just be prudent in what we're using. You have to be more proactive and maybe using vaccinations try and keep the herd health at bay so that we don't have to use antibiotics. Right, so the next thing I'm going to talk about is calf health. It's going on to this vaccination. Well, as I already said, you have to be proactive in preventing disease rather than firefighting with antibiotics. And we have to give trust to lesser known antibiotics. I've clients that all they want is the Marvisals or the New Floors of this world, when a lesser, and we've done sensitivity tests, and the sensitivity tests have come back showing that the Oxytets or the pen straps or the Betamax will work, and they have worked when they did trust them. So when I'm going to go from baby calves, some of you you're probably buying Hereford, so you don't need to worry about their health. They're very healthy calves, but it's if the calves are when you go from the first thing when you buy in calves, you're buying in, a lot of you might be changed into buying calves this year because, as they're saying, there's more margin to be made when you buy a calf than buying a weanling. But first thing you buy in, if it's a cold day, put calf jackets on. Calf jackets are very simple, cheap and cheerful. 25 euros to buy a calf jacket. Get them, put them on calf jackets. In a shed, if you have a big shed like this and you have a bunch of calves in, if you put maybe a couple of square bales of straw right in the dead centre of the shed, that there's some place to huddle and go behind. If a breeze is coming from this side or it's coming that side, they can sit whatever side of the bale of straw and it'll cut down, it keeps them a hell of a lot warmer. You want to just, on common sense, a lot of it's common sense. If you've a very cold day, like yourselves, on a cold day you're going to eat more yourself. So it's like the calves, if you're normally feeding them 3 litres morning and evening, on a very cold day, maybe like today, you'd give them 4 litres this morning. You know, they will drink more. They need to be able to maintain themselves. They need to be need to give them more food. Right, when you buy in those calves initially, maybe as babies, a good thing if they're after coming from a long trip up from Tipperary or Cork or that, first thing you should do is maybe give them a Replenolite or electrolytes. Try and replace those lost. It could be on a journey, a lorry journey, sitting in a lorry, getting cold. Replace them with Replenolite, and then go starting the milk the next morning. Leave them settle for 2 or 3 days and then vaccinate them. So the best thing is you can do them. There's a couple of pneumonia vaccines. Pneumonia is such a big thing. We're trying to cut down on antibiotics. So if any lads have ever started vaccinating for pneumonia, the amount of antibiotics have reduced drastically. You know, so it is a great job. Calves, a lot of people don't see it in beef cattle because if you get a calf, any calf that ever gets 1 episode of pneumonia, his weight gain per day is gone down from about 1 kilo down to about 0.7. If he gets 2 episodes of pneumonia, that's gone down from 1 kilo down to about 0.4. So you take even just a small 0.3 of a kilo, and today's at €7 a kilo over a year, that's equivalent of about 600 euros. So it's a huge loss for you. So for the sake of a small 7 or 8 euro vaccine, it pays no end. So like as I was saying, 2 days after they arrive, try and get them vaccinated. Better again if you can have them vaccinated on the original farmer's farm, is brilliant. Try and know the status as well of the calves you're buying. If you're buying them from the one farmer every year, if he's vaccinating for rotavirus or the new crypto vaccine, it'll cut down your antibiotic usage as well, because you'll have to vet out less. You won't be after dripping calves. If you're buying calves that are vaccinated rota and crypto, you're laughing and have them done for pneumonia. It's the main thing then when you get to when the calves get older, it's always trying to reduce stress and have them vaccinated before those stress periods as well. So the most stressful periods are weaning and going into the shed in the first winter at 8-10 months old. So try and always have either done with, I'm not going to go into the different vaccines, there's a load of different vaccines, talk to your own vet about that, but there's they cover all the angles, all the respiratory vaccine or disease will be covered, and always complete your program. It's like a lot of Bovipest has to be done twice, Bovalta has to be done twice. There's ones up the nose, they'll only last 3 months and you may have to top them up again. When you go from there, then heading away from respiratory vaccines, then it's such a cheap vaccine, a lot of people don't do it, is the black leg or Covexin 10 vaccine. For the sake of about €2 per animal, it's you've probably all seen it. You see this dead calf, big, blows up, he looks three times as good as he was the day before, because all the muscles will swell up. And then lads get them. I've done it myself. I've farmed myself. You get the calf, and the worst thing you can do is drag him up. You put the rope in the leg and drag him up the whole way through the farm. All you're doing is spreading that Clostridium. If that calf dies, get him, put him into a bucket and bring him up. Don't be dragging. You're spreading the whole disease across your whole farm. It's little tips like that that people don't know. But if you can, the first thing, hopefully you won't have to worry about that if you vaccinate them. Okay, coccidia. Coccidia is probably the number one problem we had here in my practice last summer. We did thousands of dung samples. Worms and fluke came back minimal in an awful lot of samples, but coccidia was rampant. So if you're buying in calves, try and do them from about 17 to 20 days. That should get you done for 6 weeks, and then people usually do them again about the 1st of May, 1st of June, and that'll cover you for the whole year. You've probably heard of things called calf scour syndrome. I personally don't think that's a problem at all. I think it comes down to coccidia. Coccidia has been a huge problem, and because people thought they had vaccinated for coccidia, and this calf scour syndrome then came rampant. It's probably they hadn't done them enough. They had to do them a second time. All right, the last thing I'm going to talk about is wormers. This year, we'll have to get a prescription for wormers now from the middle of June on this year. That's a new part of this NVPS. So we'll all have to play our part. There's an awful lot of resistance building up to wormers. So if you can do your dung sample, you have to be organised. And do this NVPS, you have to try and be organised. If you know you're going to be dosing on Saturday, no point coming in, running into your vet or into your co-op on Saturday morning saying I need a wormer. You will have to have your dung samples done, so if you can have a dung sample, for me to be able to prescribe a wormer to you, I have to have evidence-based, and we'll know if you see that you have some strong oils or some sort of worms in the dung sample, we'll easily be able to cover ourselves. For the first year or two, probably won't be no problem. We'll be able to get away around it, but it's after that, they'll be getting very strict, and dung samples is the only way to get around that. There's 3 classes of wormers. There's the clear, white and yellow wormers. We all know the clear ones, the Ivermectin. There's the white wormers, the likes of Albex and Tramadol, and then there's the yellow wormers, Leviside. Try and rotate those. So if you have worms in June, maybe do a lesser one like Albex. In July, change to a Leviside based one, and then maybe towards the end of the year, change an Ivermectin based one. Hopefully you won't be after doing that amount of wormers. If you're doing a paddock grazing system like Oisin, the amount of worms will drastically reduce anyhow, because you're not getting a chance for the worms to build up. One thing, always be skeptical of the efficacy of your wormer. So if you test today, worm them in the next few days, and always maybe check. No harm to check take another dung sample after 2 weeks. If you take that should be 0. If it's not 0, your wormer is not working, and maybe you have resistance built up. There's a huge resistance being built up to Ivermectin already. People are going in doing pour-ons regular, and it's every time they come in they're doing pour-ons. It's only a way of building up resistance. So try and get out of that habit. Just be prudent in what you're using. Is to use as little as you need and as little as you can get away with. So, to use as much of a wormer, to use as much as you need, but as little as you can get away with. That's the main thing to take away from this talk. Another thing, just with antibiotics, always be vigilant. Lesser antibiotics will do. They'll save you a hell of a lot more in the pocket. A bottle of Marbicil will be €90 compared to a bottle of Oxytet, pen strep, down in the mid 15s, or €15. So if you can take any way, use less antibiotics and use less wormers. Thank you.